Welcome back to another episode of Anatomy with Alex. My name is Alexandra Ellis, and I am a body nerd and self-care expert. And Anatomy with Alex is my weekly show where I share anatomy and physiology and nerdy body facts with you so that you can maximize your mobility and live pain-free in your body. Today, we're talking about knee pain, which is more than 3 million cases of this specific type of knee pain, and that is osteoarthritis, which is actually the most common form of arthritis that affects the joints. So thank you so much for those of you who are tuning in. Give me a thumbs up to let me know you're here, and let me know where you're from. Where are you tuning in from today? It's finally fall here in Los Angeles, so I can wear a sweatshirt now, because it's like 70 instead of 100. Sorry. All right, so knee pain, specifically osteoarthritis, a progressive degenerative arthritic condition, like I said. Again, more than 3 million cases each year in the U.S. And while it can be caused by increased physical stress to a joint, there's also a low-grade inflammatory process that plays a part as well. Ooh, welcome Kimberly and Olivia. So happy to have you guys here today. So this low-grade inflammatory process, research is being done right now on the effects of fat and sugar and the joints. And I have a friend who is doing research in biomechanics on this specifically. She shared a picture with me of the fattest rat I have ever seen in my life. Like, seriously, Jabba the Hutt meets a rat. It was, but what they were finding in their lab is that as the rats continued to eat this high sugar diet and get fatter and fatter, their joints were also showing signs of arthritis, even though it wasn't necessarily a wear and tear kind of thing, which often is the case in humans. So yes, wear and tear, but also further studies needed as far as it goes with inflammation and food. And so we'll talk about that a little bit more as well. So what is osteoarthritis? What does it affect? It affects synovial joints that have what is called articular cartilage. Let me pull up a picture for you. Oh, hi, Ethan. Thanks for tuning in today. So there you have a picture of the knee with the patella intact. And articular cartilage is the cartilage that lines the ends of the bone. So in this case, it's the end of the femur and also on the top of the tibia, which is your shin bone. But your shin bone, the tibia, has the addition of the meniscus. So let's just look at the femur here and the articular cartilage there. So articular cartilage, as I said, is found only in synovial joints. That covers the articulating joint surfaces of the bone. Now, it's softer than bone. It is cartilage, and that allows it to provide cushioning and shock absorption within the joint. It is made of a specific type of cartilage called hyaline cartilage, and it does have very poor blood supply, and it doesn't heal exactly the same when it's damaged. Just like any other tissue in your body, with the exception of bone, but any other connective tissue in your body, when it is injured, the healing process leaves a scar or an adhesion. Bone is the only material in your body that when it is broken and it reheals, that new bone after a period of time is just as strong as the original bone. In the case of articular cartilage, once it's damaged, and that's kind of what you're stuck with. So the pain, while I'm showing the knee, and knee pain is highly common with articular cartilage, hands are also affected because of the ton of use that your hands get. In general, the pain usually starts just after exercise, but it can progress to being painful all of the time. And this can include joint swelling and a decreased range of motion. Now, unlike other forms of arthritis, only the joints are affected with osteoarthritis. So it's not totally a systemic thing, although it is kind of because of that linkage that they're finding with rats and fat and degradation. Although I must say, we're not rats, although Peter Pettigrew was a rat human, so maybe we're not as different as we thought. It's for my Harry Potter fans here. All right, so in the case of osteoarthritis, and hey, Nicole, thanks for tuning in today. Here's another picture of the knee. You can see the ligaments in place, and this is without the patella. But again, you can see that whole bottom surface of the femur is covered in this articular cartilage, this hyaline cartilage. It's really smooth and glossy and glassy and allows it to move well. Right? If it was just bone on bone, the movement is not very smooth. Bone is hard, a hard surface. So we need something to kind of cushion that motion at the joint. All right, so here is sort of blurry. So if you just squint your eyes a little bit, you won't worry too much. When I went to the Body Worlds exhibit with the plastinated bodies, it was in LA this year. It's a really cool exhibit. I know they have offshoots of it, places like Las Vegas and New York. If it ever comes to your city and you're into this kind of stuff, totally go. Because one of the things they did have were real joints that had arthritis. So you could see it within a real body. And it really does look like this. It's like a scab or a scratch on the hyaline cartilage. And it is injured. Now, it could be because of, like we said, diet related. It could be, you just had poor mechanics and that's how you moved your whole life. Or maybe you had an injury. You tore your meniscus playing football in high school, and that injury also irritated or damaged the cartilage, which could possibly lead to arthritis onset at an earlier age. So it really is just like that little, and it's not little. I mean, it is little, but it doesn't feel like little. Like your bone has feeling, and it's not, it sucks. I mean, let's just call it what it is. Like osteoarthritis sucks. Arthritis in general sucks. So if you are suffering from this or working with people who suffer from this, like just keep that in mind too. So symptoms of osteoarthritis: pain, loss of ability, stiffness, pain that can be like an ache or burning, crepitus, which is the anatomical term for cracking. You could also develop bone spurs, where your body just starts to lay down bone to help protect and create stability in the joint. Another thing that can be present here that's often paired with osteoarthritis, but not necessarily a direct connection, would be something called loose bodies, where there are, it could even be, pieces of that damaged cartilage kind of just hanging out within the joint capsule. Synovial joints in general, not in general, all synovial joints, rephrase that, all synovial joints have a joint capsule. So it's this encapsulated wrapping around the joint. So a loose body is a loose thing floating around in there, can get in the way. And as I said, having a previous injury to that joint can increase your chances of developing osteoarthritis. So now that we have, all the sad news of what it is, a boo-boo to your bone, it's no fun at all, what can you do to prevent it? And I think the number one thing that we can do is to move more, but also to move better. So if you think of your car, right? How often do you rotate the tires on your car? Probably, isn't it like every 6 months or like 60,000 miles or something? Obviously, I have a reminder on my phone. I don't know it offhand. But you have to do it regularly because your tires don't wear evenly. So think of this as, uneven wear on your knees if you are continuing to move poorly. So be a nerd. Address the way you are moving. If you are moving in a really crappy way, figure out how to fix it, how to get stronger, how to get more flexible where you need to, how to get more mobility and control where you need to. Deal with your stuff, basically, especially in the hips and knees where arthritis is so super common. And because of that metabolic link to arthritis and finding that degradation in the joints, weight loss may also be something to consider. That, the extra weight of the body, but also the presence of that extra adipose and that fat and the inflammatory markers that includes. Losing weight may perhaps help because of that metabolic factor, not just the mechanical loading. Self-care to reduce stress and pain. So whether that is meditation to just overall reduce stress, self-massage, whatever it is, make sure you're doing things on a regular basis to reduce your stress and your pain. And then the last piece, which kind of ties into all of these as well, is an anti-inflammatory diet. And this can take on many forms for many different people. It's really a personal decision. But sugar and staying away from sugar, which is insidious and in absolutely everything, I swear to you, read the label on your mustard and you're going to find sugar in it. Cut sugar out of your diet and your inflammatory related aches and pains are going to decrease. I've seen it happen in multiple people. So try it. So that means sugar of all forms, agave, stevia, corn syrup solids. If it's sweet, don't eat it. Honey too. Now, that's not to say that cutting it out all the time is a requirement, but maybe a 30-day reset, something along the lines of a Whole30 may help. And it'll definitely give you an idea of what actually is causing the inflammation and pain. Paleo diet might be something to consider as well because of the less grain and dairy, all of which are inflammatory style foods. And while I'm not a nutritionist, you can look up the research and see this. And you can also talk to people who have gone paleo or done a Whole30, and they will tell you also that taking out sugar, grain, dairy from their diet makes their joints happier. My mom, for example, has had, partial knee replacement and has knee pain and osteoarthritis in one of her knees that hasn't been replaced. And it's like without fail, if she eats sugar after having cleared out sugar, grain, and dairy from her diet, it makes her knees ache. So it would seem unrelated, but it's a systemic issue. The environment of your body on the inside is absolutely 100% going to affect everything else. So something to consider. And also, you guys, we just eat way too much sugar. Seriously. And I love it. It is my drug of choice, I will acknowledge. But anything we can do to, just reduce the load on our body, I am all for. Do you guys have any question, those of you who are tuned in today, about osteoarthritis, about working with clients with osteoarthritis, about your own work with osteoarthritis? Make sure you drop it down into the comments and I can answer it here live. Or if you think of it later, you can come on back and post your question there and I will do my best to answer it. Next week, we're talking about proprioception and body awareness. So this is your body's sense of itself and how to improve it. So if you are a klutz and you are constantly running into things, or you feel really uncoordinated and want to be more coordinated, I will tell you the science of proprioception and how it happens in your body, and also how to improve it so that you can move like a fluid person. I actually was just listening to a podcast interview with Brandon Routh, I believe it's how you say it. He played Superman in, I think it was like 2006, like 10 years ago. And he did a lot of training in preparation to be Superman in building proprioception and body awareness through a number of different movement styles. So it's good enough for Superman. It's good enough for us. I'll see you next week. Take care, you guys, and I'll see you next week on Anatomy with Alex. Remember, it's every Wednesday at 3:15 Pacific Standard Time. Come rain or shine, I'll be here. So let me know what your questions are in the comments below, and I will see you next time. Take care. Bye.